Hello and Assalamu alaikum. I often come across students of psychology who share regarding their difficulties and problems while doing their internship and case report writing. And one of the major problems they experience is diagnosing their clients. For that matter, I shall be discussing here regarding an aspect that is very much linked to diagnosis as well as to some extent linked to intervention. So this tutorial is about case conceptualization. And I hope that at the end of this video, you will be able to understand how case conceptualization is done or what content is required for case conceptualization. Firstly, let's just take a look on that what is case conceptualization. Case conceptualization is commonly known as case formulation. It's a hypothesis or supposition about the psychological mechanism that cause and maintain an individual's symptoms and problems. Formulations can serve a number of functions. For example, these may help in identifying the complaints, understanding the significant etiological factors that may have an influence on the person's symptomology. The case conceptualization may also contribute in guiding us that which interventions may be utilized for a particular case of the client, as well as it may also help us to know that in what order the interventions may be utilized. But the point is that what a case conceptualization should comprise of. We can say that there are some key themes that exist around the content of case conceptualization. And we can say that there is a particular popular approach that is used for case conceptualization, and that is known as 5Ps approach for case formulation or case conceptualization. So talking about these different um, elements or contents or 5Ps, the first 5P is known as presenting problems. This includes what the client or mental health professional identifies as difficulties. That is how the person's life is affected and when a particular difficulty should be targeted for intervention. Let's suppose we can take an example of a person who may come up and may present his or her problem in terms of low mood, lack of interest in daily activities, lack of appetite, sleeping difficulties, maybe some weeping episodes. Specifying such difficulties can allow for a more focused diagnosis and intervention. The second P stands for predisposing factors. This comprises of identifying possible biological contributors. For example, there may be some kind of genetic vulnerability like family history of mental health difficulties. Similarly, there may be some kind of factors which may be the environmental factors like history of trauma as well as strict home environment. And there may also be some kind of psychological factors present like beliefs an individual may be holding like I'm not good enough or nobody loves me or I cannot do it. However, all these predisposing factors that we are collecting that may put an individual at risk of developing some mental health difficulty. So by understanding that, we can understand the problem, diagnosis, and can develop a suitable intervention plan. The third P is precipitating events or precipitating factors, which may include the significant events preceding the onset of the disorder such as interpersonal conflict or financial stressors or maybe some sort of illness. Because when sometimes a person suffers from chronic illness, they tend to suffer from some kind of mental health problems as well. They feel low as they do not feel fit in the world and cannot carry out a number of activities. Then the fourth P is called perpetuating factors, which comprise of factors which maintain the present problem of individual. The examples may include repeating behavioral patterns, for example, avoidance or withdrawal in a person who may be having some symptomology relevant to depressive disorders, or they may be even biological or cognitive patterns. For biological patterns, we may see that a person may be having sleep disturbances, and for the cognitive patterns, we can say that a person may be having the attentional biases, that the person is unable to focus on or pay attention to the good aspects and is only paying attention to the worsening factors or worse aspects of a particular situation. Then the fifth and most interesting factor is protective factors. This involves identifying strengths or supports that may alleviate the impact of the problem. Um, and what can we count as protective factors? For instance, the social support that is available, or the skill a person may be having, or perhaps some kind of personal characteristic the individual may be holding, those may serve as protective factors because they may help in understanding the individual that there are positive things which are present in his or her life or in the person. The identification of these protective factors create increased optimism in both the client as well as the mental health professional dealing with the person, and it contributes to a positive therapeutic relationship. So these are the 5 P's that if followed, we can construct good case conceptualization, and we can reach to good diagnosis as well as intervention plans for our clients. I hope that this tutorial will make you be able to apply the 5 P's in construction of your case conceptualization for your client. Thank you folks for watching. If you like this video, make sure to subscribe for more and like and share the video. Click the small bell icon that appears beside the subscription button to receive the notification the minute our video is uploaded. Thank you for watching. Allah Hafiz.